Garrett Smith with the Healthcare and Health Management application. The application is designed to provide for the patients a better customer experience and to provide for the doctors and providers a much more efficient way to do business, to save everybody time and money, to hold physicians accountable for bad behavior, to give patients direct access to all of their medical records, and direct access to providers. It allows for scheduling so patients and doctors can agree on a time. It eliminates the need for medical reception, medical office staff, and medical records and billing. It does this in a variety of ways that I'm going to explain now. The way that it'll work from the patient side, the patient logs in, has full access to their profile, full access to all of their medical records, including all of the doctor's notes, all the things that the patient generally doesn't see that doctors pass back and forth. Now the patient can see those, all of their prescriptions, has the ability to find any provider, including a pharmacy, including a lab, including radiology, including any other diagnostics. The patient can then select records, select providers, send the records to the provider, send the prescriptions to the pharmacy, get things taken care of by themselves, by managing those things themselves. The physicians are motivated to come to the marketplace by money. The physicians save money by eliminating the need for medical reception and office staff. The way it works is the physician makes a profile. They put up their services on the application so that the patients can search, find the provider. When the patient finds the provider, they can send a message. Hello, Dr. Jones. My name is Joseph. I have a problem with my ankle. I think I sprained it. When are you available? Dr. Jones says, oh, I see this patient. Here's a picture of his ankle right here. Wow, yeah, you got a problem there. We got to make sure that that's not broken. Let's get him in. When am I available? Looks on his calendar, finds out when he's available, makes the appointment. Now, the doctor can also look at the patient's profile. If the patient has a problem, like they're always late, whatever it is that the case may be, then the patient can, the doctor can say, I don't like this guy, it looks like he's a problem. Now, doctors already do that. Doctors are very discriminatory, and they're not doing so in a very explicit way. They're kind of, they have colleagues and they exchange information and they put little subtle cues in medical records to indicate what patients are difficult or uncooperative. Right? So there's where the motivation is from the provider. The provider gets direct access to the patient. No longer do they need to deal with medical office staff. So doctors have to pay for the medical office staff, but now they don't. It saves money. That makes it easier for doctors to start. You can get started in private practice. You don't need medical office staff. You don't need $100,000 to start a new office, or more, depending on your office. I mean, you could have a very extravagant office that could be $1 million practice to start. You don't need that. All you need is a subscription to this application and a profile, and you have access directly to the marketplace as a provider. Put all your credentials on there, all your skills, all the services you offer, your photo, whatever information that you want to include about yourself, and then the patients can access you. Now, you do have to provide good service as a provider, because if you don't, well, you're going to get a bad rating. You're going to get a bad rating from the patient. The patient's going to say, hey, this doctor was a jerk. They were late. They didn't show up to the appointment on time. I was there at 11 and the doctor wasn't ready until after lunch. He was 2 hours late, 1 star. I want my money back. Well, money back? When was money paid? Oh, money was paid instantaneously at the time of the appointment. And this was guaranteed and insured by the application. Right? So, well, now how do we resolve an issue? Well, there's dispute resolution built into the platform. So disputes can be resolved. So Back up a second here and review all of what I just covered. It's a lot. The patient makes an appointment with a doctor. There is an agreement. There is a contract. With that contract there are things that come with that. It's not just just some agreement. Yeah, I'll see you on Friday. Cool, whatever. No, the patient has to show up. The doctor has to show up. The doctor has to provide a standard of care that is guaranteed. And if the patient doesn't show up, or the doctor doesn't show up, then that's written into the contract as well. If the doctor didn't show up, they're obviously going to get a bad star rating. And if the patient didn't show up, well, it depends on the way that the system is set up. So if the patient doesn't show up, the doctor can say, hey, I'm new here. If the patient doesn't show up, I'll charge them 75% or 50%. If the doctor chooses to charge them a full 100% of the fee, then the patient's stuck with paying that full 100% fee, and that happened automatically, and then the patient's not going to get it back. The patient can try to go to dispute resolution with that issue, and if dispute resolution says, hey, we had an appointment, doctor says you didn't show up, you weren't there, so therefore no refund for you, your money was lost, next time show up to your appointment. So that's how that works. Now if the doctor doesn't show up, then the patient can say, hey, I want to resolve this dispute, the doctor didn't show up. So payment is made automatically. It is automatically deducted from the patient's account upon the time of service, and if there's a problem with the service, then there's a dispute resolution. Now, dispute resolution is something that doctors might not think is going to be a big deal, but it actually is. It's going to be a big deal, and I know this from my own experience, in that doctors, a lot of times, don't provide high quality care. And things that doctors have done to me very recently include not providing crucial records when laboratory work has been done. Didn't provide the record to me. When I called in, they indicated that everything was fine. Upon receiving the report, I realized that there are serious problems within the blood work, and those things need to be addressed, and those problems are affecting the other problems that I have. And I'm already alluding to the fact that my motivation for developing this application is related to my current health situation, which is very bad. I have some serious health issues, really serious health issues. But I'm focusing my energy on developing this application. So now doctors have to worry about their record. They have to worry about their report. They have to worry about not getting any disputes. They don't want to deal with disputes because disputes cost money. It takes time. The doctor doesn't want to waste their time with a dispute. They don't want to be stuck in dispute resolution with patients. Doctors want the patient to come, treat the patient. They want to know what's going to happen. 2 o'clock, Jimmy's coming. We're going to look at his foot, and we already saw the picture, and we got a report. We already got his blood work. We already know what's going on with Jimmy. He's 34 years old. Whatever. We know everything about Jimmy. We've seen his report. We've seen his, everything. We know what's going on. The doctor knows what's going to happen. What the doctor is expecting to happen will happen. If the doctor's expectation is not met by, for example, Jimmy doesn't show up, then the doctor gets paid anyway. Yay, for the doctor, it's a big win for the doctor. The doctor gets paid. They're not wasting their time. So now while the doctor is getting paid, they don't have to worry about double booking patients to make sure that they can make enough money, right? Double booking patients is problematic for who? Well, it's a big problem for the patient. Because let's say if you book Jimmy at 11 o'clock and you book Tara at 11 o'clock, what happens if Jimmy and Tara show up at 11 o'clock? One of them's going to have to wait, and they're not going to be happy about that. And they're going to get that, they're going to complain about that. So now the doctor doesn't have to put themselves in the predicament of, well, maybe we should try to book too many people just so we can make sure that we get enough people so that we can get paid. The doctor wants to get paid, and the doctor does need to get paid. So the doctor is ensured that they're getting paid, so that means the doctor is getting more money. Good. The doctor deserves to get more money. Now the doctor can work less, and they can save time. Now they've eliminated jobs. They've eliminated the medical reception, and we've eliminated medical billing. In fact, we've eliminated pretty much everybody in office staff. You might need to keep one person on as a skeleton crew to answer the phone for the odd person who doesn't use the internet, or not. If you're running a private practice, you don't have to have somebody in the office. You're not forced to. Nobody is forcing you. You must keep an office staff to run the fax machine. You don't need to. You can do it yourself. You can do everything on your phone. You can even send a fax in your phone, should that seem like a necessary requirement for whatever, HIPAA laws or whatever. this is my idea, and I would like some help in implementing this idea and in making the presentation more polished and allowing for a demo to be created and to create the business connections so that LabCorp, RadNet, physicians networks can come and join my application, and then it can really be created. It could really exist. This is right now, it's my idea. It's intellectual property, and it's my intellectual property, and I'm making everything known here in this video so that it's clear that it's mine and that I invented it, and this is not a copy of anybody else's portal, and that the goals are quite clear. Thank you for watching.